And I'll pull it up on my phone real quick here too, so I can make sure everything's going.
All right, we are at 10 o'clock. Welcome to HappyBrain Concussion Care webcast number 3. Awesome to have you. Thank you for joining me. In the box on the right-hand side, if you're live with me, there is an opportunity for you to ask questions. This is an open discussion. I'd love to hear from you. Just say hi, or any questions you have, please feel free to put those in the question box over on the side there. We're going to be talking today about the HappyBrain Concussion Care Program and the exam form. I'm going to take you through the exam form and what it looks like to evaluate concussions. Specifically, we're going to cover Cranial Nerve 5 testing today, and we're going to look at the trauma-free treatment protocols, how we address people with concussion symptoms, and what we can do to alleviate, alter, and relieve any symptoms that they're having. Specifically those related to Cranial Nerve 5 today. So what I want you to look at, join me, open up a window and go to HappyBrainCheckup.com. And I'm going to go ahead and pull up my screen so that you can see us going into the website. HappyBrainCheckup.com looks like this. Screen is what you should be welcoming into. You'll see it says free HappyBrain membership. You can go here and log in and create a new profile. If you've already got a profile, log in so that you can join in on the training page, which is on the other side of the login. The login is totally free. At the bottom of this page, you can see there's a Join Now button. As we keep going down through this main screen, you can do concussion symptom surveys, and there's more to come. For the HappyBrain provider certification at the bottom of the page, this is a little bit of what it deals with. And then, again, you can click this link to get access to all my training materials that are on this website. Everything here is free for humans around the world to have access to. So go ahead and join in so that we can go in and look at the page behind this and the information there. I'm going to go ahead and log in so that you can take this journey with me. And since I've already logged in, we're just going right to that page. So once you create your membership, free membership, you come in. This is your dashboard. On the left here, you'll see it says My Account, Dashboard, Orders, My Membership, etc. And then on the top of this page, we're going to go to the right where it says HappyBrain Membership, and then we're going to go down to HappyBrain Concussion Care and go to that link, and that's going to bring you to all the training materials that I have, including access to the HappyBrain exam form as well as the concussion treatment protocols. So scroll down on this page, which we access through having membership, and you can see the resource materials over here are the trauma-free treatment protocols. There's the visual exam scoring system, exam treatment card, evaluation card, with video. There's post-concussion exercise, and then HappyBrain exam. And you can click on that link, and that will take you to the exam. Before we do that, I'm just going to scroll down a little bit more. We'll look at the rest of the provider certification. This talks a little bit about the course objectives. This is a 3-hour online training course that providers can get continuing education credits for. And for healthcare providers who want to be certified providers of the trauma-free treatment, this is part of your protocol for getting certified, is going through and completing this 3-hour training program. Under the neurological evaluation procedures here, you can see there's the vestibulo-ocular reflex visual error scoring system. Cranial Nerve 5 is the bite test. Cranial Nerve 7 is the cheek puff test. It looks like that. And Cranial Nerve 12 is the tongue test. And then you can also see there's jaw function test, balance test, and then more access to some protocols here. There's video access, and then as we go all the way to the bottom of this page, here's the HappyBrain training program. We're going to go look at some of the slides as well as some of the tests that we're going to cover today. And then here's the test for those providers who want to take the test to become certified providers. Okay, so back up to the resource. This is the HappyBrain membership page. Join free membership. Link through to the HappyBrain page. Treatment protocols here. Under resource materials, we're going to the HappyBrain exam, and we're going to go look at the HappyBrain exam. So we're going to highlight that. That's going to bring up our exam sheet. Can you see if there's any questions?
Yeah.
Okay. And then so on the HappyBrain exam form, you can see we've got a place here for the patient to fill out where on their body and head that they're having issues. Top of the page is name, date, the date of their injury, motor vehicle accident, yes or no, the injury they had, questions about their injury and their concussion history, area for them to put in subjective complaints, ways they can describe the condition. So the first half of this page is all for the patient to fill out. You can see there's concussion symptom survey on here where we're dealing with physical concussion symptoms such as headache, dizziness, numbness, tingling. There's cognitive concussion symptoms, brain fog, attention, focus issues, memory issues. There's emotional issues. The two most common emotions that happen with concussions are anger and depression or sadness. And they can alter and reverse from 1 second to the next. You could be angry, and the very next second sad, and the very next second back to anger. And with younger children, this happens really fast, and so I let parents know that your child is probably going to go through these, and they're going to experience a lot of these and wonder what's going on, and keep reassuring them that that is going to clear up. That's not going to continue to be that way, and they will improve. Okay, and then there are sleep questions under the concussion symptoms. On this form, we go down, we look at range of motion for their neck, looking for any limitations in rotation, lateral flexion, and flexion extension. And then we get some neurological evaluation. In the neurological evaluation here, we can look at the person's heart rate, which is controlled by the brain. We can look at their heart rate variability, where there's alteration between each beat of the heart. Some of them are going to be a little higher, some are a little lower. We want lots of variability between each heartbeat. That's a good sign of health. Minimal variability or no variability looks like a flat line. Not a good status for your health. And then we start going into the cranial nerves where we can test them. And cranial nerve 1 is smell. If there's an alteration in the person's smell, that usually indicates that there's some dysfunction in the brain, in the cranial nerves going from the brain to the nose and altering the sense of smell. The very next test I have listed on here is the bite test. This is cranial nerve 5, and the muscles used in creating jaw movements include the temporalis muscle on the side of the head and the masseter muscle in the jaw. These are the biggest muscles affecting jaw movement. And those two are responsible for the most powerful jaw movement, which is clenching or biting down. There's 600 pounds per square inch that the jaw can produce. And so extremely powerful motion there. Much more powerful than opening or shifting the jaw side to side or protracting and retracting the jaw. So those are the 6 jaw movements there. There's lateral movements, there's protraction coming out, there's retraction, pulling it in, and then there's open and close. And so we're going to look at cranial nerve 5. Cranial nerve 5 is called the trigeminal nerve. It's one of the largest cranial nerves. A cranial nerve is a nerve, there's 12 of them. They go from the brain, they go through the floor of the occiput and the base of the skull, and they run down and they go into structures such as your eyes, your ears, your nose, your throat. These cranial nerves are responsible for vision, for smell, taste, for muscle control of facial muscles, for hearing, for balance, for swallowing, for your tongue movements, for vocalization. All of those are controlled by cranial nerves. And when there's an impact or an injury to or trauma or a disease process of the brain, brainstem, and the cranial nerves, then there's going to be an altered function of sensory or motor function that these nerves go to. Okay, so if we're looking at the bite test cranial nerve 5, well, let's talk a little bit about cranial nerve 5. There's a sensory portion of cranial nerve 5 and there's a motor portion. The sensory portion, the cranial nerve 5, trigeminal, comes into 3 areas. There's the ophthalmic area, or the upper part of the face and eye. There's the maxillary region, which is the midsection of the face, upper jaw. And then there's the mandibular region, which is the lower jaw. And so the nerve goes into the skin and muscles in this region. Because that nerve goes in those areas, if there's a dysfunction of that nerve, we're going to have altered sensations, altered neurological reflexes, and altered motor function. Now, if there's an injury there, it may not be affecting all of those areas. It may only be affecting one. It may only affect one side and one portion. And so we want to investigate thoroughly and see exactly everything that's going on. What I really want to share, what's most important to share for me today with you, is that in cranial nerve testing, just like in testing muscles, we can test them at a minimal function and see if there's deficits, and we can test it at a maximum function and see if there's deficits. And for me, I want to know that my body, every portion of my body, is operating at its maximum function and maximum efficiency. So doing minimal level testing is great if I'm looking for somebody who's really fragile, who's got lots of dysfunction and or trauma. And I want to be very guarded in how I approach this so I don't aggravate their symptoms or their condition and make it worse. That's great for minimal testing. For maximal testing, if there's nothing we find on minimal testing, then I want to look at maximum testing. I want to make sure that those functions are at their highest level. And when I do that and I find dysfunction, then I want to observe what's going on and note what I find so that I can then have an impact on what's occurring when I'm doing that. So, different ways to test cranial nerve 5. We can do sensory testing with something like a light touch. We could use our finger or a cotton swab or anything really light to touch the face and ask the person, get feedback from the person as to what their sense is. When I touch you here, does that feel like normal? Or is it super sensitive? Or is there no sensation or a diminished sensation? All of that relies on me getting information from the patient. And I can do that through the ophthalmic division, the maxillary division, and the mandibular area. And the patient may not be clear about what they're feeling too. So it's not an really objective test. It relies on me hearing what the patient is saying. And if I'm using something sharp to poke, do I see them jump and react? And then again, I've got to ask them, is that too sensitive, less sensitive, or no sensation? Or does it feel normal? Reflexes that I can test include taking something like a cotton, some cotton, and making a little tip to it and touching on the eyeball to look for the blink reflex going on. If that's diminished, then I know there's a neurological deficit. I can also go in and test the jaw jerk reflex, where I'm going to have the jaw slightly open. I'm going to tap at the front of the jaw and watch for the jaw to reflexively close. Again, this is a challenge test to the nervous system to see if the nervous system responds normally. And that response I can observe objectively to see if that response is hyper, hypo, or less, diminished, or totally absent. If there is clinically significant issue with the nervous system, I'm going to see an abnormal reflex. And there can be dysfunction in the nervous system and the reflex be perfectly functional. So it doesn't give me insight into, does this nerve function at its highest level of performance? What does give me insight into this cranial nerve 5 operating its highest performance is doing muscle testing, a motor exam evaluation. And one of the best ways to do that is having the patient bite down. Now I can test the motor function by resisting opening of the jaw, resisting side to side movements of the jaw. And that's going to be great, but that's kind of more of a minimal test, and those aren't the strongest muscles of the jaw. So I want to get maximum testing. So what I'm going to have the patient do is clench on their jaw on the left side versus the right side. And I'm going to look and observe for reaction, any symptoms that come up for that patient. And I'm going to document that. What I also am going to look at is how much effort or difficulty is there for the patient to actually perform this exam. So, yeah, I want to be on main screen, right? Okay. So, in this exam, having the patient bite down, if I have them bite down on one side and I look at them as they're doing the effort, I'm going to tell you about a patient that I saw just this past week. He came in, he was hit as a bicyclist by a motor vehicle. A car hit him while he's riding his bike. His left side of his head, his temporalis muscle area, impacted into the windshield, and then he was thrown off the car, landed on the ground, bicycle grip still in his hand, came off the bike. He's laying face down on the ground when he wakes up. So he was unconscious. There's a loss of consciousness he described to me. What was kind of humorous was that he had just gotten a call from the insurance company, and the insurance claims adjuster said to him, well, you most likely don't have a concussion because we looked at the car windshield and there's nowhere that there's a dent or a fracture of the glass on the windshield where your head hit the windshield, so you probably don't have a concussion. Now, that claims adjuster probably is not aware that the patient was unconscious on the ground. Otherwise, he probably wouldn't make that statement. So, kind of funny to me. Not so funny for the patient. And that's one of the reasons I'm really thankful I get to do what I do and evaluate people at the level I do, so I can really see what's happening to them and give them the best benefit of care and an opportunity to totally get healing for their body. So I asked this young man to do the bite test. I suspected he had all kinds of neurological issues, and I want to start at the very lowest, simplest things that are not going to aggravate his symptoms. And one issue I see with the way a lot of healthcare providers test cranial nerves is they do the minimal test, and when the patient passes, they say, oh, there's nothing wrong with the patient. and they did not do a maximum evaluation of the cranial nerve. So they don't really know if there's dysfunction at that level. So this young man goes to bite on his jaw on one side, and I can see him looking like this is really challenging, looking kind of confused on his face, like, wait, am I biting? Am I not biting? What's going on? And as he bit a little on the right side, and then I could see him shift to do the left side. And as he started biting down the left side, he just started to pass out and faint. He went, oh, and he started slumping. He got pale. He lost his balance. He started describing, I feel dizzy. And I immediately had him go from a sitting position to laying down. And he was in that dizzy, delirious, confused state for several minutes, all as a result of me having him do a bite test. How much pressure can you apply left side versus right side, and do you notice a weakness on one side versus the other? Well, as he's evaluating, am I weak on one side or the other, his body, his neurological system shuts down, and he's starting to pass out. So I lay him down. I'm done doing neurological tests on this patient for the day. Any further testing is going to be of no benefit for the patient. They already have an aggravation of symptoms that's severe reaction. Any other testing I do to this person is going to be a bad reaction. I may find false findings because they're still dealing and recovering from the symptoms they're feeling. Why did he have that severe reaction? Well, this muscle, that temporalis muscle that got bruised and damaged, he's now trying to contract at a maximum effort. And as he does that, that muscle is not ready to be working at that level. And because that muscle is directly controlled by a nerve that goes into the brain, that nerve is already in a guarded state and causing that muscle to be in a guarded state. Now I'm asking it to do work at a high level. It's not ready to do that work. And so the patient's nervous system reacts in a way that's not normal, not safe, not healthy, and the brain shuts down. If I get really technical on you, it triggered his reticular activating system, which then creates a reaction through the whole brain, causing the body to shut down. Any further testing is going to continue to irritate and aggravate that person's nervous system, and it's not worth testing. What I can conclude from that reaction is that the patient is fragile. Their nervous system, their brain tissue is already in a fragile state. Do not do further testing when you see those severe reactions. You're done for the day. I did that on the very first day of seeing this patient. I've seen him for about 4 visits now, and he's made progress. And so on his 4th visit, which was just the other day, I had him do this bite test again, thinking he's going to be better. We've been treating him. There are improvements in his symptoms and in his signs that he's dealing with. And so I go to do this bite test again as my first neurological test to see what's going on. And he has the same reaction as he had the very first day I tested it. He gets lightheaded, he gets dizzy, he loses his balance, we have to lay him down, he's getting totally incapacitated. And again, I'm done doing neurological testing today on him because I don't want to aggravate the symptoms more. I'm not going to get clear results on anything else I test. And I've got to send that patient home and tell them, you're not fully healed. This is still at a severe reaction level. rest. Your brain still needs rest. Nutritional protocols that I give him. Vitamin D is number one. It reduces inflammation in the brain. We want to reduce that swelling, irritation, inflammation in the brain. So vitamin D is one of the things we're recommending. And lots of water, rest, and then I've got other specific exercises. The trauma-free treatment protocol for addressing the temporalis muscle and the masseter muscle, I'm going to show you. This is the homework I sent the patient home with, and this is what I did in the office to help him recover from that reaction to the bite test. It's the temporalis lift. It looks like this. I'm going to take my fingers on the side of my head. I'm going to push up. As I push up, I'm going to expand my fingers open. I'm going to get up to this line where the baseball cap sits and inserts, the temporalis muscle inserts at this line. So I'm going to come down about an inch or two below that line. I'm going to take my fingers, push in lightly and gently. As I slide my fingers upward, I'm going to spread them apart so that the finger in the front is going in this direction. The finger in the back is going this direction towards the back. The ones in the middle are going straight up. And I'm anchoring that muscle and pushing it back into the bony insertion so that it gets stable. So it's push up into the insertion and hold. And this should feel very good. That should feel great. And we can do it on both sides at the same time. We push up and we hold. I'm lifting up gently on the sides of the skull. The response to this his response to this was, keep doing that. You can do that all day. That feels great. That wasn't something I asked him to say. I simply put the pressure in there and I asked him, how is that pressure? How does that feel? His response was, that feels great. That's reducing my symptoms. Can you do that all day? I laughed and said, no, I can't. But you can. And here's how. Take your fingers in, side of your skull, push up and spread them apart and hold. And as you're doing that, we're looking for that reaction that feels great. I'm going to bring up the slide and show you what that looks like. And so here we are in the HappyBrain exam. If you haven't logged in to HappyBrainCheckup.com, go to HappyBrainCheckup.com. You can go to log in there, free membership. Go to the HappyBrain Concussion Care page. This is the HappyBrain Concussion Care page. As we go down here, we were just at the HappyBrain exam, and now we're going to go to the trauma-free treatment protocols. And as we open this page up, this is a quick slideshow of the different treatment protocols, and I'm going to scroll down to the temporalis lift, temporalis correction page. And on here you can see the arrows on the temporalis muscle. You see where this temporalis muscle inserts into the skull, and it angles towards the front and towards the back. And so we're going to use our fingers on the side of our skull just like those arrows. And we're going to go up and spread. And hold up 3 to 5 seconds. It should feel great. One of the things you can do as you're doing this, if you're doing both sides at the same time, you can open the jaw a little bit and shift it side to side with a slow, gentle stretch. Make it feel good. If you are having a reaction, if you're doing to the patient, they have a reaction, don't do the jaw movement. Just do what feels good. So if we add the jaw movement, it looks like this. We're going to lift and hold and pin that muscle into the insertion point, open the jaw slightly, and shift. We're looking to release that tension. That muscle is going to come down into the top of the jaw. Now what's not in this picture and down here into the lower part of the jaw we have the masseter muscle. So when you clench your jaw, you can feel that masseter muscle contract, and you can feel the temporalis muscle contract. What we can do at the masseter is we can pull this down a little bit or just hold pressure right in. And this should feel kind of good too. So we're lifting up at the top, pushing down at the bottom. You can do a little bit of that at the same time on one side. Upper hand's pushing up, lower hand's pulling down. And again, we want to hold that for 3 to 5 seconds. We're looking to reduce the symptoms, and symptoms that get reduced by this movement are headaches, confusion, brain fog, that cloudy sensation can start to dissipate. Ear pain, ringing in the ears can be altered by these moves. Balance and loss of balance and dizziness can be cleared up. TMJ issues, jaw pain, jaw clicking, jaw issues can be cleared up by this exercise. I'm not saying that it works 100% of the time, but it works better than anything else I've found. All right, so if you have questions, please feel free to share those at this point. And let's go back to our main website. Let's go back to the HappyBrain exam page, and we're going to pull that. Well, actually, before we do that, let's scroll down to the bottom of this page, the HappyBrain Concussion Care Training Program. And in here, we've got seminar notes for Hour 1, seminar notes for Hour 2, seminar notes for Hour 3. And then there's the audio slides that go with each of these portions. I'm going to go into the seminar notes Hour 2. And as we open this page that's going to load, we're going to go down to and look at cranial nerve 5, the temporalis muscle again. These are some of the treatment protocols that you see going on here. There's the temporalis correction again. And different treatment protocols in Hour 2. All of these are for reducing cranial nerve dysfunction. We go down nutritional support and other treatment protocols. Hour 2 is all about treatment protocols. And then I'm going to go back into Hour 1 and yeah, gotcha. Good. Okay, so Hour 1, as we're going down through, I'm scrolling, there we go. I want to look at concussion signs versus concussion symptoms. The difference between concussion signs and concussion symptoms. Concussion symptoms are something I have to ask the patient, what are you feeling? What are you experiencing? Tell me what's going on. Do you have nausea? Because I can't see that. Do you have dizziness? I can't see that. I can see you stumble, I can see loss of balance, and I can document that. But I have to ask you about a symptom. Signs, I don't have to ask the patient anything. I can observe. And those signs tell me this person has some type of issue going on, and mostly that's a brain trauma, neurological deficit issue. Concussion signs are things that happen usually as a result of an injury. There's a fall, somebody's been assaulted, there's a car accident, there's some shaking of the brain or impact to the head. Either something hit the head like a ball or a bat, or the head hit something like a wall or the ground or something overhead. So the number one sign of a concussion is a visible head or face injury. So if you see somebody with bleeding from their head, most likely they've hit their head on something and they've had a concussion. What does it take to diagnose a concussion? According to the World Congress on Concussion in Sports, back in 2012, they said it only takes one symptom. The patient says, I have a headache. That could be a concussion. The patient says, I'm dizzy, I'm dazed and confused. That's enough to diagnose a concussion. Now, we want to combine that with what event happened that caused them to have this headache or this dizziness. And if we see that there's some shaking, jarring, or impact to the head, we can add 1 + 1 and say concussion. No doubt, brain injury. Now, that brain injury may be very minimal, or it may be really severe. So anytime there's a head or face injury, that is a sign of a concussion. Any loss of consciousness for a second or for 5 minutes, any loss of consciousness is a sign of a concussion. Now, you may come across somebody who is passed out. Does that mean they had a concussion? No, they may be drunk. They may be having a reaction to some medication or some drug. There's no telling. They may have low blood sugar and passed out. Now, if in passing out they hit their head, now they have a concussion on top of their low blood sugar. So, loss of consciousness is what we want to look for. Balance or motor incoordination. You see them stumbling, swaying. Well, do you smell alcohol? If you do, they might be drunk. And they might have been drinking and hit their head, and now they have a concussion. And so they could be stumbling, they could have slow or labored movements. If we can combine a balance issue with a head impact or a shaking of the brain, we can pretty much conclude concussion. A blank or vacant look. Some people, and you can see this in children, they have this 1,000-yard stare. They're just staring 1,000 miles away. That is a sign that they may have a concussion or some brain injury going on. Can you say from that there is a brain injury? No, but it's a sign that most likely there's some type of brain injury or some type of neurological deficit. They may be suffering from petit mal seizures, not the grand mal seizures where they totally are on the ground and having issues, but that blank stare. It's something worth noting and looking at it. It is a sign of neurological deficit. And again, if we combine that with some impact or trauma, we can say that's the sign of the concussion. That includes a disorientation or confusion. If you've been snowboarding and you get caught up in really deep snow and you get thrown, no impact to your head, but there's a whipping action. You go from high speed to low speed really fast. There's that fast deceleration, whip. There's no impact with the ground, but your brain may have impacted inside your skull with your bony skull. And now you're a little dazed. Ooh, I saw stars. I feel a little confused. I'm a little dazed. That may last for a couple seconds, 2 minutes or longer. Those are all concussions. They may be really small and they may be really big, but they are all concussions and they do add up. I know personally because I've had a bunch of concussions. And if that person has an inability to respond appropriately to questions, hey, do you know what day it is? Thanksgiving? We're not in the month of December. This is February. Something's not right here. If they're having excessive emotional reactions or slurred speech, those are also signs of concussions. And then loss of memory. What we want to know about loss of memory. How long Where's their memory loss? Do they have a short-term memory loss? Do they have a long-term memory loss? Is their memory loss like, I can't remember anything right before the accident, or I can't remember things that happened after the accident? Those are all questions we want to ask to get more definition. But loss of memory is a sign of concussion. And you can see that the person doesn't remember. They may not remember their name or somebody else's name. They may not remember times or events. Excellent. And then one of the things that I also want to address are red flags. Acute concussion. Somebody just hit their head. They are having dizziness, confusion. And we want to know, do we keep this person up all night? Do we send them to bed? Do we take them to the hospital? What do we do next? Well, what we want to really look for are the red flags. What's the big issue with a brain injury? Is that they're going to bleed out, they're going to be bleeding in the brain, and it's going to lead to their death or a coma. Those are people that need surgery to stop the bleeding in the brain. That's what you're looking for the most. If you see this picture on this slide, you can see all the blood vessels coming up into the brain. And so if these are bleeding anywhere, specific areas of the brain are going to have specific reactions to where it's bleeding. If somebody has a stroke, they're bleeding into the brain, and they're going to have dysfunction of that area of their body. Could be swallowing, could be their facial muscles, could be one side, upper extremity, what have you. But in the first 48 hours after an injury, we want to look for what's dangerous. What do we want to pay attention to that we've got to get this person to the hospital now? And I want to start off first of all and let you know that if somebody has had a loss of consciousness and they're not waking up, we want to wake them up. But if they have not had a loss of consciousness, or if they've had a loss of consciousness and they're now awake, awesome. Now we want the brain to recover, which means we want them to sleep. And I want that patient to sleep 20 hours straight. Please do not wake them up. Do not go with this old wives' tale that you've got to keep waking a person up or they're not ever going to wake up again. That's not true. They need sleep, and when you interrupt their sleep, you're interrupting their healing. Let the person sleep and recover. Don't interrupt them. Don't have alarms or lights or loud sounds. Let them sleep. Okay, back to the red flags, the danger. When we want to take them to the hospital, when we want to call 911, you can't wake them up. Call 911. Get them to the hospital. If they're having convulsions, if they're having a seizure, call for help. If you look at their eyeballs, one is really large and the other one's really small, that is a sign of severe brain injury, bleeding into the brain. Don't hesitate. Go to the hospital. If they have a headache, that is the most severe headache they've ever had in their life, and it keeps getting worse, just shoot me now, I want to die, this is horrible. 911, come get us, we're going to the hospital right now. If they had vomited at least 2 times, go to the hospital, get a CAT scan, find out if there's bleeding in the brain. If there's not bleeding in the brain, great, you've done everything you need to know to make sure that person is safe. There's been a study that's shown that vomiting twice, once, twice, is highly correlated to people having bleeding in the brain that will show up on a CAT scan. Weakness, numbness, or decreased coordination. The person feels a little weak and a little run down. I just got hit in the head. I don't feel right. I'm a little disoriented and I just don't feel very strong. I just want to sit here. Okay, well, let's walk to the car. Okay, I'm walking to the car. I'm staggering. My coordination, I can't quite coordinate my body to walk upstairs. And it's getting worse. Call for help. Get that person evaluated. Slurred speech. They've been in an accident, they've got a brain injury, and they're slurring their words. That usually indicates bleeding in the brain. Time to go to the hospital. I actually had a patient who had been in a car accident, doesn't drink, was keeping a log and a diary of her daily experiences from that car accident. And within less than 30 days, she had a second car accident, and she comes out of the car and she's angry, she's cussing out the other driver, and she's slurring her speech. Oh, and by the way, with a brain injury, you kind of lose inhibitions in the words you use, and you will say all kinds of foul words and inappropriate language, and that's what this person was doing. And the police officer that came to the scene was going to book her and test her for being drunk, except that the passenger in the car said she doesn't drink, but she's slurring her words so bad and she can't walk straight. She's stumbling. Brain injury. Degrading awareness or emotions. The person who's saying inappropriate stuff and being emotionally inappropriate. They're laughing, giggling 1 second, crying, and then anger, and then giggling again, and they're all over the place emotionally. Or they just keep crying, and then they're getting worse, and then they're getting angry, and then they're crying again, and it keeps getting worse. Take them to get evaluated. By the way, young children are more vulnerable. Smaller skulls, thinner bones, more fragility there in their tissues, much more likely to have a lot of emotional reactions. And then babies and children that won't eat or they can't be consoled. So the child rolled off the changing table, or they smacked their head on the coffee table, or they fell off the bed they were jumping on and hit their head on the dresser, one of my concussions. And so they hit their head and now they're crying. And they cry for a few minutes and then they get a little better, and then you sit down and here, let's have something to eat, and they're starting to feel better. That's great. That's normal reaction. We want to see that. When we don't see that, when they don't stop crying and it's going on and going on and going on, and it's a half an hour now and it just isn't changing, let's take that child, let's take that baby for evaluation. Let's go get a CAT scan. Let's see if there's bleeding in the brain. The good news is only about 1% of people who get CAT scans for brain injury actually require surgery. So that's great news. But for those who actually need surgery, having the brain bleed, you could be saving their life. You could be helping prevent them having major neurological permanent damage by getting them care. And my statement to you is, let's err on the side of caution. If you think this person needs evaluating, go take them to the hospital, go get a CAT scan for them. Let's make sure that their brain is safe. Let's make sure that there's not bleeding going on. That's the big danger. After about 48 hours, you're usually pretty safe with most people. If they're going to have an episode, it's going to happen within those first 2 days. And what I want you to do is, if this is somebody you're caring for, check in on them every 15 minutes to an hour if they're having these red flags. If, as you're evaluating them, after many hours you're not seeing this, you can go to checking in on them hourly. And if they're sleeping, check in with the person that's checking in with them. You don't have to wake them up, but let's check in. If you haven't heard the story about the skiers who hit their head, have an injury, go home, they feel fine, and then the next day they're dead, it's because nobody was checking in on them and seeing what symptoms they were dealing with. So that's something we really want to look at. Have somebody there evaluating, checking in with them. All right. So this is hour 1 of the HappyBrain training program. We've got, I'm going to go back to our main screen here. In the HappyBrain training program, this is happybraincheckup.com. You can join for free, When you join, you get access to the whole training program. This is a 3-hour training program. Here's hour 1, hour 2, hour 3. These are the audio recordings that go with each slide. This is the HappyBrain test for providers who want to be certified to provide my trauma-free treatment protocols and be recognized as a HappyBrain concussion care provider. Here is the test. You can take this test, submit this, as well as submitting videos of you performing the trauma-free treatment protocols and the evaluation, neurological evaluations. Some of those neurological evaluation procedures include the vestibulo-ocular reflex. This is my #1 screening tool. And if you look at the front page of HappyBrain Checkup, you get access. Everybody in the world has free access to evaluating their own concussion or having somebody evaluate that concussion for them. It's the vestibulo-ocular reflex, or VOR, and that is basically a head shake. We have the person take their head, they're looking at a target straight ahead of them, then they're going to take their head and they're going to rotate their head left and right 1 rotation per second. It looks like this. 1, 2, 3, 4, stop. Focus. If there's a loss of balance, if there is a difficulty in focusing on the target, those are signs and symptoms that can be aggravated by that, include dizziness or a headache or brain fog. So if any of that occurs when they do that at 1 rotation per second, you're done testing that person. They have neurological issues going on that indicate they have a concussion. You don't need to do any further testing. They need rest, nutritional care, light therapy, sound therapy, manual manipulation. All of those things can contribute to brain healing. Those are protocols that are all utilized to help heal brain injuries. Okay. The next set of neurological evaluation procedures, what we're going to cover in the next webcast, are going to be more of these neurological tests, including the visual error scoring system. We're going to do visual exam of the eyes, because the eyes, there are 3 different cranial nerves directly attached to the eyes, and those have origin throughout the brain. Over half the brain is connected to the eyes. So if you really want to evaluate brain issues and concussions, we're going to look at the eye function. And again, there's minimal test and maximal test. And if we get any symptom aggravation at any level of testing, we're done. That's confirmation that the patient has neurological deficits, and we don't need to do further testing. They're fragile. We've confirmed there's dysfunction. Now we want to treat that. Okay. Then there's the cranial nerve 5 bite test, which we went through today. There's going to be the cranial nerve 7 is the cheek puff test. The cranial nerve 12 is the tongue test. All of these you can actually go through my training program and look at all this and see everything I have to say, and do that today or at your own leisure. There's the jaw function test. There's a balance test. The jaw is highly involved in head traumas, brain injury. Typically, if you look at a whiplash patient, and we'll just take a car accident, a rear-end car accident scenario, the person's in their car, they get hit from behind, their body goes forward, then their head whips back. As their head whips back, the jaw gets opened and strained. All these muscles, the temporalis and masseter muscles, get strained. And then the head gets whipped forward. The jaw closes really quickly and shuts down. And now we get strained through the masseter and temporalis muscles again. Now these muscles are all in this strained state, and the brain tells them to guard and protect, tighten up. because we don't want more injury, more issues. And by the way, when you go to do maximum function, the brain's going to go, no, you're not allowed to do maximum function, you're injured. So as you go to bite on the left side versus the right side, and the brain is not allowing that muscle to fully engage, it's going to shut down and go weak. And the person's going to notice a difference in their power, right side versus left side. And that's what you document. Here's where they're at today. We do the treatment protocols, the temporalis lift, to release that tension and allow that cranial nerve and muscle to get back to a normal state, a normal tone, to go from this tight, guarded state of the muscle. And by the way, if you palpate the muscle, if there's any tenderness, that indicates that that muscle is in a guarded, strained condition. And as we do the temporalis lift, that muscle should relax and release its tension and get back to a normal slide glide state. When we do that, we should see the bite test return to normal. By the way, the future of cranial nerve 5 bite test is having a dynamometer, a measuring device that we can actually have the patient bite on this probe, this sensory probe, and compare their bite power on the left side versus the right side. And we can look and document at how many pounds of force are they able to produce, left side versus right side. So we get a comparison and we can see if there's greater than a 20% output, that has significance. If we see that the difference in power output is 50% or greater, we know there's significant dysfunction going on for that person. And that's something we can objectively document. And then, as we apply treatment, we should expect to see that that reading, that pressure power output on that gauge, as the person heals, that should increase and get back to a normal left side, right side balance. That's also something I'm taking on to do more research of cranial nerve 5 testing and documenting the effectiveness of these treatment protocols and these evaluation procedures for people with brain injuries. So thank you for joining me today in the HappyBrain Concussion Care Program. I hope that you have gotten benefit out of this for yourself and for the people you love and care about in your life that are dealing with brain injuries, and that you now have something you can do to help impact yourself and the people in your world to reduce those issues, hopefully eliminate the brain fog, the headache, the jaw dysfunction, and the jaw pain. And tune in for our next webcast coming up in February. The date is February 16, I believe. I'm confirming right now. Let's see, February 16, right here on the HappyBrain Concussion Care webcast. Thank you for joining me. If you have any questions, please let me know. I am here to be of service to you. Have an awesome day. Go make your brains happy. Thank you.